Okay. Good morning, everyone. This is Sharon and Robert Porter from Trucking and Business. And we have a special guest on today that's going to be talking to us specifically about healthcare for truckers. So, Mike, why don't you go ahead and introduce yourself and you can take it from here.
Absolutely. Thank you. Thank you guys for having me. I'm always excited to connect with, people on stage, off stage, and just, contribute to what they have going on. I really believe in the mission here, trucking and business. And anytime I can help, I'm happy to be of service to you guys. But in case you don't know me, or I guess for the sake of conversation, you don't, I'm a Health Unicorn Mike, the guy with the unicorn on his head. I'm a nationally licensed, award-winning health insurance broker. I offer affordable health coverage that creates tax deductions for small businesses. I've helped thousands of entrepreneurs and their families. I'm actually licensed in 33 different states. I've been in the industry for 9 years, and I have access to 95% of plans available. So let's talk a bit about insurance. 'Cause that's the topic of the room here. Help specifically truckers, right? So truckers are about 70% of my clientele. I talk to them all the time. Talk to dispatchers, I talk to shippers, I talk to brokers, I talk to carriers. If you're in the logistics space, you've probably talked to me or you want to talk to me. And don't worry, we're going to make sure that you do that today. Okay. So let's talk a bit about how insurance works in general. All right. So when you're under the age of 65, I use 65 as the point of delineation because 65 is usually the Medicare age. Now, I speak Medicare as well. I was in the industry for about 5 years there. I speak over 65, under 65, I speak life. I also have disability partners. I have commercial trucking partners. I've got partners all over the insurance space. It's kind of my thing. It happens to be the language that I speak, right? So the way that health insurance works specifically, when you're under the age of 65, we're going to focus on under 65 for the record, because most truckers are usually under that age. If you are over that age, definitely we can talk about Medicare. I can connect you. Let me know. Not a problem. Either way, so we'll focus on under 65. So under the age of 65, there are three ways to get full coverage in the United States of America. The first option is an employer/group coverage. Now, that's only applicable for those that have over 50 employees. If you have under 50 employees, things are actually going to be done on an individual basis. The reason we use 50 as the delineation there is because the rules actually change with over 50 employees. For example, the federal government requires this random tidbit that you'll get for being in truckers and business. The federal government requires that if you have over 50 employees, that company covers 50% of the cost of insurance. Now, if you have under 50 employees, this is why the point of delineation matters, that obligation doesn't exist. So now you can have your employees, for example, be 1099, W-2. You can set up your S Corp, your LLC, your C Corp, however you're setting up your company. But if you use that point of delineation, 49, comparatively to 50, you don't have the financial obligation in the same capacity. Now, further, if we go further into health insurance a bit, so outside of the group and employer benefits options, those are going to be typically done entirely different. So those are, a lot of people are used to that, right? So you have like your high deductible plans, you have your HSAs, you have your FSAs, you have a lot of this jargon that nobody understands unless you speak insurance, right? Well, luckily for you, you got a guy that happens to know this language pretty fluently. So your main thing when you're dealing with insurance, whether you're going from a regular route plan to an owner operator, you're just have a group insurance in general, you're getting new to the space, you're just getting your feet wet, whatever it's going to be. From a health insurance perspective, you still want to know a few things, right? So one of the things that you want to know is that your network is your net worth. So whether you go employer plan, mind you, I'm going to talk about that for half a second, and then I'm going to switch to the other options there. So when you're dealing with the group coverage, right, you have things like an HSA, which is when you use your pre-tax dollars to go towards buying things outside of having to pay towards the deductible. Right. So let's say you needed medication, or you needed dental work, you needed vision. You would use an HSA if you were under an employer plan to pay for something like that, because again, it's using pre-tax dollars. There's ways that you can overfund that. You can fund it quickly. Talk to a financial advisor. There's all types of interesting strategies with the HSA if you happen to need that route. Right. But from a health insurance perspective, the thing that matters the most is your network. So I tell everybody, I'm in a lot of rooms and a lot of spaces, on a lot of podcasts even, and I tell everybody that your network is your net worth. And that is specifically indicative in health insurance, right? So there's actually multiple different networks that exist out there. There's actually about 5 of them. Usually I go over 3, but because I want to give extra to this great group here, I want to make sure we're talking about all 5. All right, so just bear with me. I want to break these things down because they're not common knowledge. Okay, so we're going to go from the bottom to the top, from the lowest to the highest there. So the least of them is what's known as a PFFS, right? That's a point for service type of system, or point for sales type of system, a point for service type of system. So in essence, what it means is that they're going to cover about up to 10% within regards to an in-network discount, and then give you a line item benefit. It typically means that you want to avoid that type of insurance because you're going to be seeing less doctors, you're going to be more limited, you're going to get less benefits, and on top of that, you're going to be paying more money out of your pocket in most instances. So if you can, typically avoid PFFS. The one right above that is a POS. Now, there are things known as an open access or an open network POS, which tries to operate like a PPO, but it doesn't give the same network discount. So again, with the network, we're talking about a network discount, but we're also talking about the doctors you can go to, the hospitals you can attend, the labs you can go to, the places that really need your services or that you're going to need their services. That's where your network is at. So it truly is your net worth, right? And when we're kind of dealing with the networks and kind of understanding them, understanding these letters are very important because they determine how much money you pay out of your pocket. We're going to use, I'll give you an example here in a moment about a $10,000 barometer. We'll kind of break that down, but I want to make sure we're going over each thing individually first. It's supposed to be like a master class, an in-depth analysis in regards to insurance. So I wanted to make sure I'm presenting it to you in that capacity. All right. So 1 second, just a sip of water for a moment.
Mm-hmm.
Tell me if I'm talking too fast. I'll make sure I'm trying to slow down, but it's a process. Okay?
No, you good. You go keep going. Go, keep going, brother. Keep going. Keep
all right, no problem. So we have PFFS and we go to POS. So a POS is a point of service system. Now that typically means that you can't see the doctors that you want to see unless you have an employer type of coverage, which again is over 50 employees, in which case it may be something known as an open access POS, which means that you can see more doctors, but the POS still only gives you up to about 15% on your in-network discount. So if we use an example, right, of let's say you had a procedure is $10,000. For the record, 86% of all claims are under that $10,000 threshold. And additionally, 86% of all claims are typically an accident. Most people don't realize that. You're much more likely to be in an accident, not like a car accident necessarily, but a health accident than you are to get sick. So for example, somebody I had a client, this was 3 months ago. He was trying to be a client of mine. We weren't able to do business, right? But I said, okay, no problem. And I have a lot of clients, I have like 3,000 of them. So I figured it would be okay to let him go, right? And anyway, he cut his hand, right? Random situation, he cut his hand. I was like, oh my goodness, that's terrible, right? And he's calling me to get the insurance, of course, after he cut his hand, because when I tried to call him, he didn't want to answer the phone. Truckers or whoever it's going to be, if you get a chance to talk to me and get a chance to speak to me, take advantage of that opportunity and let's have a real conversation. Let's get you situated and don't make me chase you. Because if you actually need it, then I actually want to help you. The last thing that you want to do is to have what's going to happen in the situation I'm going to describe, right? So I was chasing a guy for about 3 months. He didn't want to answer the phone. It's like, no, it wasn't saying no. He just wasn't responding after telling me that he wanted the coverage, right? So it's my job as an agent to make sure I'm doing my due diligence. I'm not the type where to bombard you, right? There's a lot of people in the industry kind of operate in a telemarketing type of stance where they're just, I don't operate that way. That's not how I function. It's part of what makes me a unicorn in the space. I'll get to that, I guess, randomly in a moment. But the guy cut his hand, right? And he went first to the emergency room, random tidbit for the room. Don't go to the emergency room unless it is an emergency. I'll give you an example of an emergency, at least from an insurance perspective. You're having a heart attack. You're having a stroke. A limb is falling off. Those are situations where you could be about to die. That is when you go to the emergency room. That is what it is for. Anything else, instead, go to an urgent care. You will save 90% on your cost, if not more. Also, from an insurance perspective, it's going to definitely be a much easier explanation if you're trying to get maybe better coverage in the future that you went to an urgent care than you went to the emergency room. Okay, just hypothetically. Other thing that people don't realize when they go to an emergency room, and he didn't realize, I'm going to kind of get to this, is there's what's known as a facility charge. So he went to the emergency room, cut his hand, right? So I said, okay, what happened? When did you go to the hospital? Yes, I went to the hospital. All right, first problem. Second thing, did you go to the emergency room? Yes, I went to the emergency room. Okay. Third question as an insurance person, did you go in an ambulance? At this point, I'm just trying to make sure we're stopping the hemorrhaging here. Not even, I don't know if I can even help you, but if you took an ambulance because you cut your hand, we're having a whole nother rigmarole. For example, random nugget for the room. An ambulance ride typically costs $5,000. It's the most expensive taxi ride you'll ever take in your life. That's probably even with insurance. Not that you pay that out of your pocket, but that's what the cost of it is, right? This is why you get insurance, to mitigate these types of costs. Your whole point of insurance is to mitigate risk. Well, your greatest challenge, especially if you're in the trucking space, you guys are fantastic. You're entrepreneurs, you're building, you're growing, you're on the road, you're taking care of your families. I talk to truckers all the time, right? And one of the biggest things that we've realized, especially with truckers, is that when it comes to the insurance, you need to mitigate your risk. You have a lot of liability at stake. If you, for example, fall out of your truck trying to get out, right? And let's say that it's not a workers' comp claim. Maybe you don't have workers' comp. Maybe you're a small carrier, right? For whatever reason. Mind you, get workers' comp. Definitely recommending that. Talk to a commercial insurance broker. Can definitely make a recommendation if that's something that you need, okay? Also, you deal with your general liability. I won't get into the freight terms. It's not my lane. I'll stick in my lane in regards to health insurance. But just wanted to make sure that you know that there are resources out there, people that want to help you specifically, right? So you want to mitigate risk, right? You want to make sure that you're not paying a lot of money out of your pocket either way. So let's say you fell out of your regular car, not your truck, because workers' comp, but let's say you fell out of your regular car and you hurt yourself, right? Like, oh man, that really hurt. That sucked. If you go to the ambulance, $5,000 off top. That's what's happening. Guess what? Another random nugget. If you go to the hospital, for signing into the hospital, which is known as facility charge, that's where another $5,000. It can be 5 to 15, depending on if you have insurance. If you have no insurance, now we're having a whole other conversation. So before you've even had anything done, you're looking at between $10,000 and $20,000 because you went in the ambulance, and on top of that, right, you went to the emergency room. Again, emergencies, go for emergency situations. I'm not telling you not to use your insurance. I'm telling you to use your insurance intelligently if you're going to get insurance specifically. Okay, so we have just $5,000. So he cut his hand, went to the emergency room, did not take an ambulance. So we're dealing with $5,000. I'm like, okay, fair enough. I know this, right? Because I speak insurance, right? But he doesn't speak insurance. So he doesn't know this. He didn't log into Trucking and Bosses, so he doesn't understand the importance of this. That's why it's critical that you guys follow them, that you follow them on Clubhouse, that you follow them on YouTube. They're fantastic folks. They're fantastic resources, and they're definitely just trying to help. Okay, so he cut his hand, went to the emergency room. I said, okay, let's ask some follow-up questions now. What did you get done at the emergency room? Did you get stitches? Nope, I didn't get stitches. Okay. Did you get a skin graft? No, I didn't get a skin graft. Okay. Well, what happened? Oh, well, they said the skin was too thin to get a skin graft. And also they said that I couldn't get stitches because of where it was at. I said, okay, so what happened? Oh, well, they gave me some bandages. They wrapped it up, told me to let it heal. He paid $5,000 for a Band-Aid. Had he spoke to me instead, he would have paid $100 for the same situation. That is why you have to get insurance. That is why you need to connect with Health Unicorn Mike. That's why it's a critical time to have this conversation, because open enrollment is going on right now. It's actually going to be ending January 15th. So back to the networks here. I want to make sure we're on top, right? Are you guys picking up what I'm putting down?
Yeah.
This is some great information.
Some great information. Yes, it is.
Yeah.
Let's just keep rolling. Just keep rolling, Mike, because
keep going. All right.
Yes, sir. Keep going. It's
not a problem.
Yeah, we truly need to hear this, because it's a lot of stuff that we truly don't know. But I definitely want you to tap into how much it costs to, start once you go through the listings of insurance groups that you have,
Okay.
You know, just tap into, basically how much, that costs. And
What's the
I think
cost?
you're talking about the percentage of it, which is also good. But from what I'm hearing right now, man, you are really nailing this thing, and we appreciate this because you giving me some insight that I need, so I know what I need to do now on certain things. So keep going, Mike. Just
and I'll
keep
continue.
going,
Not a problem. I just wanted to make sure. So the next one up above that is an EPO. So the guy again paid $5,000 for hurting his hand. Something simple. Had he had insurance, had he had the right plan, he would have paid $100 out of his pocket. So the next one up, so you go PFFS, lowest one, and you go POS. Then the next one above that is an EPO. An EPO is going to stand for an exclusive provider organization. Okay. Now that one's going to get you up to about 25% on the network discount. The reason I'm going over these numbers, the percentages specifically, is because I'm going to give you a reference point so you can kind of see exactly what I'm talking about. Okay. So that guy that had spent $5,000, hurting his hand, right? Let's just say for the sake of conversation, it was a $10,000 claim, which again, 86% of all claims are. Well, if you went with a PFFS, right? So with zero insurance, you got no mitigation, no risk mitigation, right? Because you had no insurance. So you had to pay $5,000 out of his pocket for a Band-Aid. Let's just say it was $10,000. You paid $10,000 for a Band-Aid, same type of situation, right? If he goes up to the next network, the POS, it give you the percentages there. I think it's 0 to 10, right? I'm sorry, the PFFS, 0 to 10. So 0 to 10, what that means is that's the network discount. That's how much money they're going to take off the bill before they give it to him or before his insurance kicks in. So with a PFFS, they're going to take away 10%. They're legally within their right, and that's actually exactly how the plan would work in that capacity. So when people say, oh, insurance sucks or insurance is a scam or blah, 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 it's because they don't understand insurance. It's because they don't understand what they're buying. It's because they haven't connected with people like yourselves. It's because people, typically speaking, are so consumed with everything else that sometimes they're not able to see some of the things that may actually matter to them, right? We're all busy. 2020 has happened. 2021 is happening. Pandemics are going on. I understand. But this is why it's so critical to tap in with you guys and make sure that you guys follow Trucking Bosses. All right? So that same procedure, 10,000. PFFS, 0 to 10%. POS is going to be you to 15%, right? So now you're getting the network discount, 15%. I'm taking off, so for first example, 10%, I'm taking off $1,000, boom. And then to give you a line item benefit of, let's say, for sake of being a PFFS, $150. They've covered $1,150 of your $10,000 procedure. And guess what? That's what you decided because you went with a PFFS. That's how that works. That's why the network discounts matter. Okay, so PFFS, you go POS, same thing, 15%. Same scenario, $10,000 barometer, they're going to cover 15%. And then they're going to give you a line item benefit, probably of $300. So if we do 15%, Trucking Business, not Trucking Bosses. It's a long day. Sorry. I had a baby yesterday, so I'm thrown off today. I was happy to be able to get here. My apologies.
No, it's all good.
So POS, right? 15%. So same example. They're going to cover 15%, cover 1,500 of that $10,000 procedure. Going to give you a line item benefit of probably 300, right? So now they're covered 1,800 of your $10,000 bill. Definitely better than the 1,100 of the first one, and definitely better than the no insurance of having no insurance, right? But you're still disappointed and still like, this is terrible. It's because, again, your network is your net worth. It's a direct correlation when it comes to health insurance, right? And then you go from POS, the next one above that is an EPO. An EPO, again, is an exclusive provider organization. That's going to get you to 25% on your in-network discount. Same example, 10,000, 25%. They're down to 7,500. They're going to probably give you a line item benefit of 1,000. Now your bill is $6,500 that you now owe because you chose an EPO, an exclusive provider organization. Then you have the one above that, which is an HMO. This is one that people are more used to. This is what the one that they see usually with their jobs, right? Now, an HMO stands for a health maintenance organization. Okay, network discount 35 to 50%, right? Those plans are designed for preventative measures. So it's a kind of random refresher. PFFS, points for service system. Recommend avoiding that if you can. POS, point of sale or point of service. In essence, both of them you're pretty much cash paying. Avoid both of those if you can. An open access POS means that you can see more doctors, but you're still getting the same in-network discount. Then you have an EPO, which is an exclusive provider organization. Again, in the biz, we like to say it's so exclusive that none of your doctors are going to take it. So typically means you're not going to see most doctors. PFFS, POS, EPO, typically not going to be able to see most doctors. They're not going to accept the plan because it's only paying at the network discount rate. So that's oftentimes when doctors like, oh no, you got a PFFS and I don't know if I can see you. You're like, but no, I got random insurance company, Blue Cross, I've got Aetna, I've got Cigna, whatever. None of that matters. What matters is the network. That's going to matter much more than a name on your card. Okay? Random nugget for the room. Then you have, after you have HMO, health management organization. So that's 35 to 50%. So same example there, 10,000. Use that same barometer. They're going to cover, let's just say 50% for the sake of conversation. So they're going to cover 5,000 on your in-network discount, right? And then they're going to give you probably an additional 1,500, 2,000. Let's say 2,000 for the line item benefit. They've covered $7,000 of the bill. They've handled their obligation. You still are left with a $3,000 bill. But you're like, oh my goodness, this insurance is terrible. No, the insurance did its job. It's just what you chose to be your insurance. This is why you have to do your research. This is why you have to come to places like this, Trucking and Business, and make sure that you're taking care of yourself, right? And then you have the best option, the granddaddy of them all, is a PPO. Now, a PPO is going to stand for Preferred Provider Organization. So remember the HMO, those are county specific. You can't travel with those. So you're a trucker, you're OTR, right? You're going from California to Vegas, from Vegas to Texas, from Texas to Alaska, whatever it is, right? With an HMO, those are county specific options. The only time that you can use, random nugget for the room, the only time you can use your out of network benefits or that you're going to get an insurance credit for that is in an emergency situation. Remember what I described an emergency as. Not as cutting your hand. No. Again, go to urgent care. But, a stroke, losing a limb, etc. If none of those things are happening and you go to the emergency room and you have an HMO plan, let's say you live in Texas and you have an HMO plan and your load is in Oklahoma and you have this emergency situation happen outside of your truck, because we're not talking about workers' comp, we're talking about health insurance, right? And whatever happened, you go to the doctor, you go to the hospital, go to whatever, you're paying your out-of-network rates. Out-of-network rates aren't those pre-negotiated rates that I just talked about. Remember those percentages I gave? 10 to 20, 15? Those are the pre-negotiated rates for those doctors within that network.
Wow.
If your network is minute, think of it as concentric circles. So the smallest the circle, PFFS, the lowest amount of doctors take that plan. Then you go next, POS. More doctors take the plan. Then you have EPO. A bit more doctors take the plan. You have HMO. That's county specific. In your county, you're probably good. But for example, if you are, let's say you're in Florida, right? And you go from Hillsborough County to Hernando County. That's 20 minutes out the way. 20 minutes. But now you're in a different county. Guess what? You're now out of network. So all those doctors that were part of that HMO have nothing to do with where you're at because now you're out of the county. So guess what? Now instead of paying that 50%, now they're going to come down to that 35% we talked about.
Wow.
Right?
Wow.
If not less. Just depends on where you go. Unless that emergency situation, they're going to give you your full benefits with the plan. And then again, the best one, the biggest one of them all, the one that doesn't even have a circle, it's wide open, is your PPO, Preferred Provider Organization. They're preferred because these are the doctors you want to see. They say in the African American community, I've heard this at least on Facebook or other diatribes. It says cops are to Black men what doctors are to Black women. I thought that was extremely unfortunate. But part of the reason for that, or part of the reason people think that, is because of your network. You're only able to see 5 doctors in your area with your PFFS. 5 doctors total. And one of them is probably not the doctor you want to see. Another one isn't going to accept the plan. The other one is going to only take cash pay. Now you're down to 2 doctors because of what you decided to do. And guess what? When you see those 2 doctors, they're only covering 25% of the bill because of your network that you chose. But if you chose a PPO, now you have 10,000 doctors to choose from. You can itemize what you want. You can say, hey, I want to see a doctor that speaks Creole. I want to see a doctor that speaks Spanish. I wanted to see a doctor has been in the industry for 10 years. You have your perfect, credentials, your mixing pot. Well, that exists only in the land of the PPO. So HMO, 35 to 50%, PPO, 60 to 80% in network discount. So if we're doing the same math here, $10,000 procedure, right? And it's covering 80% of an in-network discount. That's upfront. That's before you've paid anything, before the insurance is kicked in. This is what they've taken off. They've taken off 80% of your bill. Now that $10,000 procedure is down to $2,000. Well, guess what? That PPO is going to cover $1,950. Now you come out of pocket $50. But if you didn't pay attention to trucking in business, or you didn't connect with Health Unicorn Mike, you instead messed yourself up and got that PFFS because it was with Blue Cross, or it was with, Oscar, or it was with whoever it was, because you saw the name, but you didn't pay attention to the network. The network is your net worth.
This is great information. I mean, wow,
On that note, tell them how to get in contact with you.
Absolutely. You can check out my website. You want to know something about insurance? Check out my website, www.healthunicornmike.com.
Outstanding. Wow. Wow. Man, I'm glad that we had this interview with you. And, again, I don't want to hold you up because I know you have a newborn. And again, congrats, man, to the baby and to you and the family as well. And I will be looking forward to seeing you on Clubhouse, talking on Clubhouse, and man, I'm glad that we ran across you. I tell you, you just really helped us out. And I don't know if you have any other thing that you need to add. So,
well, we're actually going to have Mike on Clubhouse with us talking about healthcare for truckers January 4th at 11 a.m. East Coast time. So we're going to go into that. And of course, we're going to be putting all of his links below as well. I've definitely enjoyed this interview with you, Mike, because you have definitely given us insight. And I believe it will give a lot of insight to a lot of truckers, fleet owners, owner operators, across the board on what type of insurance that we need to be looking at. And it's definitely making me rethink about the insurance that we have. So definitely. So we'll say, thank you for this interview today. And, we welcome you guys, or thank you guys for tuning in to Trucking in Business today. And we look forward to, the next interview, the next topic that we'll have. And with that being said, we'll say, be safe.